It's emerged that dozens of patients who had their 999 calls wrongly categorised by the East of England Ambulance Service subsequently died. Today, full details have been released into why managers deliberately changed the way that thousands of calls were prioritised 11 months ago. The ambulance service says no one was harmed.
The serious incident report was made public last Thursday. More than 8,000 patients were affected, and it meant they had a longer wait for an ambulance. Today it's been revealed 57 of those patients died while they were waiting, but the ambulance service says they were not harmed because of its late arrival and would not have survived because they had terminal illnesses. Some say that raises questions.
It's shocking that some of the most vulnerable patients were in effect written off by the ambulance trust just when they needed care the most. What we need to see, and what families need to see, is an urgent review which looks at whether those 57 died sooner or earlier than they needed to.
Ambulance call-outs are prioritised into 6 categories depending on how ill the patient is. It's emerged some who should have been seen within 8 minutes were downgraded by 4 categories, and instead of getting an ambulance, only received a phone call within 20 minutes.
The changes had been made by trust managers against Department of Health guidelines and only came to light after call handlers raised safety concerns to the chief executive.
We've had fewer resources than we should have for some time, and that's being addressed by the recruitment programme. However, we needed to get the high clinical care to those patients who need our care the most.
Today, the Trust told us our paramedics cannot give treatment to those patients with a do not resuscitate or provide the support their family needs. Sending an ambulance when we cannot clinically help the patient can extend the family's distress unnecessarily. There has been one complaint from a relative of a patient. The Trust Board says it's written to them explaining what happened. Nikki Fox, BBC Look East.